You said you want to support the government through this next phase, but are there conditions in which you wouldn't support the government?
Well, the first thing we need to know is what the government plans are. I've been concerned that the government was slow into lockdown, slow on testing, slow on protective equipment, and may now well be slow on an exit strategy.
And did the Prime Minister not tell you anything about it yesterday?
I made it clear I'm not asking for lockdown to be lifted. We will support the government on lockdown being in place for as long as is necessary. Nor am I pushing them on a timing. What I want to know is, what's the plan for the next phase? Because we need to plan for it. Decisions need to be taken now. So I made that clear to the Prime Minister.
Are you getting the scientific advice that the Prime Minister is receiving that would allow you to make a judgment about what's best?
What I asked of the Prime Minister is that I could have one-to-one briefings with the experts, the government experts, on a Privy Council basis, and he's provided that. So I've got no complaints there. But the decisions about what comes next...
And can I just ask you on that, what is the basis on which you're getting that advice? Can you share that with your own experts?
Well, it's Privy Council advice, and therefore it's confidential, but obviously it informs me. But so far as the exit is concerned, the next phase, it's partly scientific, because of course we need to know when the infection rate is down, but it's partly political, because the decisions will be political in the sense of, do you get your schools back into operation? Which bit of your economy do you think ought to come out of lockdown first? These aren't scientific questions, they're political decisions, and they need to be taken. And the Prime Minister said he wanted transparency, so if he's going to have transparency, let's see what the plan is, let's look at it, and frankly, if we can support it, then we will, but we need to know what it is.
Tests, well, two simple questions. One, do you support the 5 tests?
The 5 tests I don't quarrel with, but they're preconditions for lifting the lockdown. They don't tell us what happens next.
Sure, but the 5th test says no second peak that overwhelms the NHS. Now, we've had a peak that hasn't overwhelmed the NHS, and yet the number of deaths is arguably going to be the worst in Europe. You surely wouldn't be underwriting a second peak of that magnitude.
No, I don't think anybody wants a second peak, and what we're all trying to do is to work towards the infection rate going or maintaining it below 1 so that we decrease both the number of cases and the number of tragic deaths.
So you don't want to see a second peak at all, is what you're saying?
Well, look, I hope there won't be a second peak. I don't think anybody would want a second peak. But what we need is an answer to the question, what happens next, or what's the plan for the next stage?
Now, how do you weigh the mental health costs of lockdown, the economic costs of lockdown, against the palpable and appalling deaths that this virus delivers?
Well, by having a conversation with the experts about what combination of measures will keep the infection rate down, at the same time as having a conversation about what happens next. And that's why what I've called an exit strategy, or a plan, needs to be discussed as soon as possible, because they're precisely the questions that we should all be engaged with. I've been talking to businesses, to trade unions and communities across the country. They understand lockdown, they understand we must stay in lockdown, but they want a conversation about what's going to happen next.
Now, what do you say to those voices who... they understand that this is a new politics, but they still think that you should be tougher with the government, more robust with the government?
Well, what I've said is that we will have the courage to support the government where that's the right thing to do. On lockdown, it's the right thing to do. But we'll have the courage to challenge them where they're going wrong, either by making mistakes or going too slowly. That's why we've gone in hard on them on testing, gone in hard on them on protective equipment, not to score a political point. I don't think many people want to see that. What they want to know is, are you challenging on the issues that matter in order to make a difference? Has testing gone up since you've been challenging? I think the answer to that is yes. Has protective equipment been raised as a really serious challenge? I think the answer to that is yes. So it's constructive opposition in that sense.
Will there come a moment, though, when it would be right to blame the government for what's happened?
Well, look, I'm sure there's going to be an inquiry. It's inevitable at the end of all this.
A judge-led inquiry?
Sorry?
A judge-led
Well,
inquiry?
look, I'm sure there's going to be an inquiry. At the moment, I think the focus should not be on whatever inquiry it might be in the future. The focus needs to be on what we need to do to get through this crisis.
And can I just ask finally, you spoke to the Prime Minister yesterday.
Yes.
Did you raise with him the data that appears to show that our outbreak and our death rate is as bad, if not worse, than any other country in Europe.
Well, I've raised that publicly, and it's a real cause for concern because the government's advisors 6 weeks ago were saying that the hope or what success might look like would be to keep the tragic number, below 20,000. We now know that it's already 26 or 27,000.
Probably much
and
higher.
we're only halfway through or whatever, and therefore we run the risk of having one of the highest death rates in Europe, and that's a serious cause for concern.